A patient that would benefit from dental implants would be someone that's seeking a replacement for a tooth they lost or might be losing soon, whether that's from infection, unrestorable tooth, that sort of thing. But it should be a patient that's fully aware of everything that goes on with the process. So we offer free consultations when we're concerned about implants, and we just walk through the entire process. Patients, missing a first molar, for example, that's a highly functional tooth, and if they've been missing it for decades, when they finally get that tooth back, it changes everything because it takes a lot of less pressure off of the rest of their teeth in the arch. That it protects everything, and they're able to chew and smile and not have a hole in their smile. So there's multitude of factors and just facets where the dental implant can change their life. Maintaining an implant is as simple as maintaining a tooth because it's fixed, it's in your mouth, it's not going anywhere. So rather than a removable partial denture where you have to take it out, scrub it, soak it, it's in your mouth. So brushing, flossing, and just making sure you're getting rid of all the plaque around it, it's like it's a tooth. Just as the phrase says, beauty is in the eye of the beholder, truly value is only determined by each patient. Every patient's different. If I were missing a tooth, I would certainly consider an implant the best option for it. So they're not the least expensive thing in the world, but value is always driven by the individual. So I always just talk about pros and cons with each individual patient. A lot of patients will see the value in it, and if it's something that maybe they can't afford in that moment, then something we can make a payment plan with, strategically save for. So implant is definitely worth the time, money, effort that it requires. Technology has changed for dental implants so much through the years. So now we are completely planning everything digitally. So we don't even have to get a patient numb before we're already looking at the case and looking at where an implant should be. So we take a 3D x-ray, we merge it with an intraoral scan, which is like a digital model of the patient. And it's really sophisticated what we can do before we even get started. We can show them the digital model, show them the whole workflow, and present an opportunity that could change how their teeth come together and their function. It makes it more predictable, and it just makes everyone have a healthier, happier outcome. Really, the patients have a lot more confidence in knowing exactly where we are in the process and just being able to see it on a big screen, be like, oh yeah, that's my arch, that's where that implant will go. Yeah, let's do that. So technology is amazing what we can do for patients. At Kennedy Dental, with our implant dentistry, we don't cut corners with our dental products. We strive to only place the best materials and the best products in our patients' mouths. I personally love the Straumann implant system. It's really predictable. Tactily, it just makes sense for me. I've had a really great time getting to know the Straumann catalog of implants. And if I needed an implant in my mouth, I would want a Straumann implant. So I've been really happy to get better at placing Straumann implants and offer that for our patients at Kennedy Dental. A lot of people suffer from missing teeth for a number of different reasons, and we just want to provide all the options to help them go through life and be happy and confident and healthy.